Hi there, my name is Terence Berry. I am one of the co-owners of a group of preschools called Peak Child. We just wanted to put something together which is based on a presentation that a good doctor friend of ours has given. She's been guiding a number of schools in Cape Town around how to prepare for returning to school. So that's for the staff, the learners, and for the parents. So just some basic guidelines. So it's really just a very basic guideline to the coronavirus and how we're going to be considering it from a school's perspective. There's a lot more detail available on our website in terms of the protocols and the procedures that we'll be following. So I would encourage you, if you're a parent at one of our preschools or a staff member, to go and look at those documents there. So what is the coronavirus? Well, there's quite a lot that we know about it, and a lot more gets disseminated every week. We know that it is a virus. It's called a coronavirus because of the little spikes on it, which take the form of a crown. And a crown is what corona is in Spanish, actually, corona. How contagious is COVID-19 or the coronavirus? Well, today, 26th of June, we looked at yesterday's numbers, and there were 9.5 million people that were confirmed cases worldwide, and 120,000 in South Africa. So that is obviously not the actual number of cases. Those are only the confirmed number of cases. And particularly when the virus is growing and more infections are happening, it will be many multiples of that in a particular space. The thing that most medical professionals will look at is something called the R0 scale, which is how infectious is a particular virus. Thankfully, the coronavirus is not too infectious. The problem is that people are asymptomatic when they have it, so they don't show the symptoms, they're not tired, and they will continue with life as per normal, infecting people. But you can see in the diagram here that the COVID-19 has a 2 to 2.5 infection rate, or R0 score, whereas something like H1N1, which is another virus, typically a sort of flu virus, would have an infection rate of 1.2 to 1.6. And the Ebola virus is a similar sort of level, 1.6 to 2. If you compare that to something like measles, which is much more infectious, I think that has an R0 scale of about 15. So we're quite fortunate in that it's not nearly as infectious as one of these terrible diseases like measles, but it still is very infectious. What we're aiming for is to get that R0 score down to 1 or less to get the virus under control. What are some of the symptoms? I'm sure many of you are familiar with this, but you can see that fever is the most common symptom, so that's why you would have these thermoscans. You'd be asked questions about whether you are feverish. The next very common symptom is a dry cough, so not a phlegmy, throaty cough, but something that's very dry. So and that would happen in the early stages. There's sometimes mucus production in a third of cases, so a bit of phlegm, but not a lot. Sore throat only in 15% of cases. Muscle pain also only in 15% of cases. Fatigue is very common, so in 40% of cases, 38% of cases, you have a lot of tiredness coming on. And then 20% of cases show shortness of breath. So the good news as well is that of the infections, 80% of them are mild infections. About 14% are severe, and only around 5% are critical infections that actually require intensive care. The severe infections would require hospitalization, not necessarily going into the intensive care unit though. So it is looking likely that the virus is going to be with us for a number of years, and that we're going to be doing life quite differently for that period of time. Now, it's quite important to distinguish between the coronavirus and just a cold or flu in terms of the symptoms. And most testing now, just because we don't have enough capacity to test, to actually do the tests, most people are now just doing symptomatic checks. So they're asking you various questions around those indicators that I mentioned earlier. You can see here that fever is very common in coronavirus, but also in the flu. Fatigue is very common with flu, but only sometimes is present with coronavirus. And a cough is very common. With a cold, a cough is not that common, but with flu, it is usually a dry cough like the coronavirus. There's generally no sneezing involved with the coronavirus, so that is not a symptom. Aches and pains are common. Runny nose, not very often, or a stuffy nose, a sore throat, you saw only 15% of the time, not much of that. Diarrhea is not very common with coronavirus. Sometimes you have a headache and sometimes shortness of breath. So that shortness of breath is something that you would have with coronavirus that you wouldn't have with a cold or a flu. So that's just a table that you should probably just press pause and take a look at and check it out in a bit more detail. So what is the good news about COVID-19? Well, we know more and more each week. We know what it is. We know that it's a respiratory disease that's to do with your lungs and breathing. We know what it's caused by. We also know how it's spread. So it's most commonly spread now between people. It's thought that it originated with animals, but now the main way in which it's spread is when we have close contact with other people. It can also be spread by touching objects that have the virus sitting on it, but the evidence is now showing that it's more commonly spread by having close contact with people who have the virus. We also know how to detect it. There are these symptomatic screenings that we can do, and then obviously there is a much more detailed test that can be done. We also know what to expect. So we know how long the virus typically lasts. We know what happens once you have contracted an infection, and we can follow the different stages of the progression of the illness. And of course, we know what precautions to take, how to actually prevent people or to limit the number of infections that are taking place, and we'll be getting to that. Who's at risk? In terms of age, well, we know from the terrible experience in Italy and the experiences in China that the elderly are far more at risk than anybody else. You can see here that for those who are older than 80, they have a very high fatality rate. That's people who actually die once they contract this. It's up to a quarter of those who contract it will die for those older than 80. Around 20% in Italy of 70 to 79-year-olds, and then the numbers drop quite dramatically after that. And you can see the numbers only really start picking up when people are older than 60. So particularly for grandparents and older parents, this is going to be a high risk. But the numbers drop right down when it comes to children. And really encouragingly, in Italy, there were no children that died. 30,000 other people died, but no children. There are these things called comorbidities. So that's when you have other illnesses, and these contribute dramatically to the death rate. The big items here are hypertension, so high blood pressure, diabetes, or some people call it sugar in South Africa, and then various other blood diseases, so artery diseases, hyperlipidemia, and then some other diseases which are listed for you. But you can see the main concerns that we have are hypertension and diabetes. HIV, there's still evidence evolving around that. We're not sure the extent to which being an HIV sufferer will compound your risk of death. Now, something that most people are very interested in, the survival times of the virus. So you can see in air, the virus can last up to 3 hours. On cardboard, 24 hours, so a day on cardboard. And then we get to the big guns. Plastic, 2 to 3 days. Stainless steel, so cutlery typically, also 2 to 3 days. Copper pots and glass and wood, 4 days, and metal, the worst of all, 5 days. So if you think of your keys in your pocket, that can carry this virus for 5 days. Other items like door handles and the taps that we use to wash our hands, all of these things are super carriers of the virus. We found that alcohol, hand sanitizer is very effective at killing the virus. It has to have more than 70% alcohol and more than 80% if possible, but more than 70% will kill this virus. So if you're unable to wash your hands, you should be using hand sanitizer. But washing hands is by far the most important thing. For young children, some schools have used this glitter idea. So imagine putting glitter, smearing glitter all over your hands at the start of the day, and then just seeing what happens. And you know what it's like. You start touching your face, you touch all the surfaces around you, and there's glitter everywhere. So that is very much what the virus is like. It's like having glitter on your hands. You may want to try that with your children just for a day. It'll be messy, but it will show them quite graphically what it is. Then obviously social distancing is very important. So 1.5 meters to 2 meters is what is being recommended by the World Health Organization and by the South African authorities. If you're waiting in line to drop off your child, we would recommend you, well, we have to have you 2 meters apart. So there will be strips on the ground to show you those distances. It will feel very, very strange, but I'm sure you're getting used to that in shopping centers and other places where we have to wait. And then obviously for children in the preschool, it's difficult to maintain a social distance, but our staff will do the best that they can. But you need to be talking to your children about this, that hugging, kissing is just they're not going to be able to do that for a while. Now our staff will be reinforcing. So if you are feeling sick, you should stay at home. Particularly look through those symptoms and do a self-assessment, assess your child, and you should remain at home for 14 days is the guidance there, if you're showing all of the coronavirus symptoms. How do we prevent the virus other than staying at home? We wash our hands. That's by far the most important thing. Wash your hands with soap for 20 seconds. You know that story. Sneezing, coughing, cough into your elbow. If you have a tissue, then you should sneeze or cough into that tissue. You should throw that away immediately, and then you need to go and wash your hands. Your eyes, your nose, and your mouth, very, very important not to touch any of those items. So catch yourself when something's itching, and we're all going to start itching a whole lot more. But really try and catch yourself, because that is the only way that the virus can make its way into your body, is through your mouth, through your nose, or through your eyes. And then obviously, as I said, if you're sick, you have to be very aware of the people around you. Masks are very important, and you need to isolate yourself, but more on that in a bit. So there are 5 keeps for keeps. The first is keep a mask on your face. Keep your physical distance, so that's 2 meters. Keep washing your hands. Keep your hands away from your face, and keep being kind. Lots of questions around whether we should use masks or not. You can see here on the charts those countries that did not recommend the use of masks saw a very, very high case rate in the early days, whereas the section circled in blue is where the countries mandated the use of masks for the public, and you can see that their curves are much, much lower. They managed to flatten those curves dramatically, possibly through a number of different measures, but masks played a big role, we believe. There are different types of masks. So we recommend for elderly people using the masks along the top. So the surgical mask is probably the cheapest one that you could get hold of. For people who don't have high risks, just a cloth mask is what is being recommended. But you can see that they have no ability to actually stop you getting the virus from the outside. What they will do is prevent you from giving the virus to somebody else, well, limit your ability to give the virus to somebody else. So that is why masks are being pushed so hard. In our schools, the guidelines from the Department of Social Development are that children 5 and under should not wear masks. There are obviously dangers in them wearing masks, and they're uncomfortable. And I'm sure for those parents out there with children of this age, you will understand why they're saying that. So for us at school, it's going to be all about hand washing and keeping our safe distance and just being very careful. Our main concern is for our teachers, our staff, that they are all having to wear masks during the day, and we have provided them with visors as well, so that that will provide just a bit of extra protection. The nice thing about a visor is it actually prevents you from touching your face. So why should you wear a cloth mask in public? I don't know what your experience has been, but mine has been that when I go out, probably 90% of the people around me are wearing masks. Some people just don't care or don't think that they are at risk. That is not why we're wearing masks. It's because we don't know necessarily that we have the virus. And so the masks will stop us giving this coronavirus to the others around us. So parents will have to wear masks when they arrive at school, and we would encourage you just doing your everyday activities to be wearing masks when you're outside of your home. Hand washing is the most important thing that you can do to stop the spread of coronavirus. So that's with water and with soap. It's doing a number of different actions. So you're doing your palms, you're doing between your fingers, like this on both hands, you're doing your thumbs, both of your thumbs, you're doing the backs of your hands, you're doing just the underside of your hands, and then you're taking your nails. Try and keep your nails clipped as well, and you rub your nails on your palms like that, and then you're pretty much done. That should be about a 20-second hand wash with soap and water. Rinse them off with water. Another piece of guidance from our doctor was that you should not be wearing jewelry, because jewelry, in particular gold and silver, are very good harbors for this virus. So try not to move around in public with jewelry on. And to our staff, we will not allow them to wear jewelry to school. Thermal scanning, there's a lot of debate around this. We are required to scan children coming into school to test their temperatures, but the actual temperature tests seem to vary quite a lot. But this is a reasonable test, and this is a test just for fever. It's only testing the exterior of your body. You actually need to really test the interior of your body with a proper thermometer in your mouth, but we're not going to be doing that for obvious reasons. So for children in school, increasingly it is being seen as this is perfectly safe for children to be at school. They are the least likely to actually contract the virus. They're less likely to spread the virus, and very low risk of getting sick or of dying. You can see the numbers there. As I said before, in Italy, no children died when there were 30,000 adults who died. So for our teachers, are they at risk? Well, we've done a good assessment of all of our staff in terms of their biology, their physical health, and various factors. So that's what you see down the left-hand side. It's actually which group they would be fitting into, and we've categorized all of our staff in that way. And then along the top, you've got the sort of work that they're doing. So if they're coming into contact with a lot of other adults, say a taxi driver, they would be at very, very high risk, or a security guard. Teachers are actually not at all that high risk in schools because children are not very good spreaders of the virus. But of course, other teachers are. So we need to ensure that our staff are keeping their distance from each other at all times. So what happens if you know that you have come into contact with somebody who has tested positive for coronavirus? The definition of a positive contact is if you have spent 15 minutes face-to-face with somebody 1 meter apart. So face-to-face could be in a taxi if you've sat next to somebody for 15 minutes, or if somebody in your household has tested positive. And what happens to people who have come into contact? Well, you should be isolating them for 14 days from the point of contact. And after that time, you can then return back into the public and back to work. So that's really the bulk of this. our final message is really just to stay positive. We know how hard it's been for these months and months of lockdown, of having your children at home with you, of trying to cope with getting back to work, of being a principal or a deputy principal in your home. We know it's been tough, but we just want to say we really are very proud of you and very thankful for all that you're doing for your children. And we are really looking forward to getting back into our preschools and hearing the sound of laughter and learning in our classrooms and corridors once more. And we look forward to welcoming you back as soon as we get the opening date from the Department of Social Development. Thanks very much. As always, feel free to contact your principal to ask more information. We'll be conducting full training of all of our staff in the coming days before we open. So the principals and the staff should be able to answer any of your questions. Thank you so much.